Hey there, it's Dr. Topher Fox. Today we are talking about diabetes nutrition and specifically just why are vegetables important for health. And so stick around till the end and we'll have a couple tips for how to get more vegetables into your diet. So let me greet everybody who is coming on to watch this in replay. Glad that you are checking this out. I had a day in clinic, so I'm an endocrinologist. I had a day in clinic recently where I asked 4 people to talk about their nutrition and specifically just to remember what they had eaten in the day prior. And out of those 4 people, it was shocking to me that the total number of vegetable servings among those 4 people was 3 vegetable servings. So 1 each for 3 people, and somebody had no vegetables over the course of a day. And I have to admit, I know vegetables are great for me, but I've never naturally loved them. I grew up in California, and my mom said, well, we had a plum tree in the yard, and my mom said that from starting when I was about 3 years old, I used to go out and stand and feel the plums before they fell to the ground and would wait until they got ripe on the tree before picking them. I've always loved fruit, but never been a huge fan of vegetables. And so why is it that vegetables are important? You know, I think sometimes we forget to stop and ask ourselves why this is. And I'm hoping that by bringing a couple items up, that it will make you and me more motivated to get our vegetable servings. And so 3 reasons why vegetables are healthy, why we want them as part of our diet. 1 is that they are nutrient dense. By that, it means compared to the number of calories they have, they are chock full of vitamins, right? We think about vitamins like vitamin A and vitamin C and vitamin K. These are all important for making our body be at its best. So they're chock full of nutrients compared to the level of calories that they have. So we get a lot of bang for the buck, basically. And there's a lot of small molecules in vegetables that we don't even think about. And so one example is, let's talk about cruciferous vegetables like broccoli or cauliflower. There's a molecule in there, it's got this long fancy technical name, glucose, I always have a hard time saying it, glucosinolates. Glucosinolates, which as they are prepared, so as the vegetables are cooked or as we eat them and we digest them, they turn into a number of molecules like indoles that basically have powerful anti-cancer effects. So they help our body to be at its best. So that's reason number 1. Reason number 2 is that vegetables have a lot of fiber. And we know that fiber is really good for our bodies. It's good for our gut health, right? These days, the more we learn, the more science keeps coming out about how important the bacteria are that live inside us, specifically in our colons. And those bacteria are fed by fiber. And most Americans don't get enough fiber. So people are supposed to shoot for at least 37 grams per day. Average American gets about 16 grams. And so vegetables are, they are full of fiber. Now, third thing is that vegetables actually can change how your body responds to the carbohydrates that you eat, specifically the starches that you eat. And it's known that people who eat vegetables before their starchy carbohydrates will have a lower blood sugar response than if you eat the starchy stuff first. So by eating your vegetables first, just like Mom said, you can actually change your blood sugar response to a given meal, even if you're eating exactly the same thing. So let's think about a few tips now for how to get more vegetables in your diet. So the first thing I would tell you is just to get comfortable with a couple of cooking methods. And 2 that I love are steaming. Steaming is thought to be one of the healthiest ways to prepare vegetables. And things like broccoli or cauliflower or green beans, super easy to put them in the steamer on the stove, usually about 5 to 7 minutes. I like them still a little bit crisp, but just enough to take some of the crunch out. And they taste delicious. So steaming, and then the other one that I love is roasting. And so again, for me, simplicity is really important. particularly this time of year, wintertime, roasting vegetables, they can be delicious. And so broccoli and cauliflower are great. Sweet potatoes, beets, these are all things that are super nutritious and super easy to roast. So typically if you cut them into small pieces, put them on a cookie sheet, throw them in the oven at about 400 degrees. And so we do convection bake for about 15 minutes. I like to drizzle a little bit of extra virgin olive oil on the top and cover them with just a pinch of salt. And then about 15 minutes, flip them once as they are in there. Second tip for vegetables, so get comfortable with cooking second, is to experiment with spices. So those same two methods that we just talked about, steaming and roasting, by using different spices, you can get different flavor profiles that will make them less repetitive. So again, for example, using, say, pepper versus red pepper flakes, that's a favorite of mine, versus something a little bit warmer like cumin or turmeric, will give the vegetables a very different flavor. And then third thing is just to look for recipes. There are a lot of recipes that are out there for vegetables that are delicious. And I have a daughter who is vegetarian, and she has kind of broadened our horizons. And so one tip is just to have a vegetable-friendly cookbook around. I grabbed one here that's one of our favorites. It's this anti-inflammatory diet and action plan. But just flipping through here, you can find things like, here we go, grilled pineapple with, pineapple with sweet potato. You know, who would have known that those two flavors go together? So it can be a healthy fruit and vegetable dish that is easy to make and tastes delicious. So those are a couple tips to help get you started. I am going to be on Facebook for most of December and the early part of January relatively frequently to help you get through the holidays if you have diabetes and are looking for nutrition and other diabetes tips. So I invite you to share this with anyone you think might find useful. And if you want to get notified when other posts come, please, Dr. Topher Fox, check out the profile page, like or follow, and I hope to see you in the future. This is going to be the end for today. I thank you for listening. Take care.